We're back at the Ferezy Clinic with Dr. Ferezy, and we're going to talk today about acupuncture.
Absolutely. Let's go ahead.
So I know two things about acupuncture, that it's been around for a long time and that it originated somewhere in Asia. But today you're going to tell us a little bit more about acupuncture.
Yep, and you're right. It did originate in China, and it's about 4,000 years old. And it really didn't come to the United States until the 19th and 20th century, but it's widely used in Korea, Japan, and other Asian countries.
So what kind of things can acupuncture treat?
There's a wide variety of conditions, and there's two different types. You know, there's an acupuncturist, and then there's physicians who do acupuncture. Physicians who do acupuncture tend to limit it to musculoskeletal pain, arthritis, tendinitis, those kinds of things. Acupuncturists tend to treat a wide variety. They'll treat all kinds of liver disease, cancers, all kinds of things that they believe have a component of healing in acupuncture. So there is actually quite a difference. The National Institute of Health published a list of conditions that they found scientific evidence, at least one report showing that acupuncture may benefit, and it included things like nausea, vomiting, dental pain, addiction, menstrual cramps, and of course osteoarthritis of the knee, which we'll talk about a little more detail.
And a lot of people think that acupuncture is kind of kooky, but it's actually proven to work.
Yes, they've done quite a bit of research. The NIH put together a special team to investigate whether or not acupuncture worked. And again, it goes from cancer pain to post-traumatic stress disorder, even with something like in vitro fertilization, where they find that women have a greater rate of pregnancy when it's used with acupuncture.
Wow. So how does that actually work with the needles? You have to strategically place them somewhere.
Well, nobody knows for sure, but what the studies are pointing to is that there's a nucleus in the brain for pain, and it seems that when the acupuncture wires are put in a patient, that nucleus is less active, so there's just less perception of pain.
In our previous interview, we talked about how complementary and alternative medicine isn't prescribed as much as, you know, Advil, ibuprofen, but it can have the same effects and help just as much.
Absolutely, and as I said in the last show, the benefit is if you're taking medications or if you have liver disease, or if you're taking even these over-the-counter things, the NSAIDs, as we said, Aleve, Advil, aspirin, for a long period of time, they're damaging your body. Whereas acupuncture and many of the other mechanical sorts of therapies can be used in patients that can't tolerate for various reasons, either for medical reasons or they might just be too brittle for a chiropractic adjustment.
Mm-hmm. And an MD may not prescribe acupuncture as a way to solve some problem like back problems or knee issues, but it can work.
Exactly correct, yes. It's, even though the information is out there and it's published in medical journals, it just doesn't seem to be getting through. We're talking about studies that are 40 years old now, and I still don't see anybody talking about them or acting on them. And that's been a frustration.
So I'm absolutely terrified of needles, but does this hurt?
Actually, it depends where the wires go, but usually it doesn't hurt at all. In fact, why don't I just show you how it works? So of course, normally we would have done a history, we would do an examination to determine what's wrong with your knee. But you did mention that you do have occasional knee pain, so we are going to go ahead and just put a couple of wires in to show you what this is like. So assuming that you have chondromalacia patella or patellofemoral pain, the first thing we're going to do is make sure that none of the bacteria that might be on your skin would get into your blood. So we're just going to use an alcohol swab and clean off the area. And we're just going to do 3 wires up here.
Okay.
Sometimes I'll do 4 and then 1 down here in the ankle, but we'll just do, we'll put 1 in and we'll just go from there.
So when you put the wires in, you're targeting a certain nerve?
We're targeting a certain point, trying to avoid nerves.
Oh, okay.
So what's happening, and that is again a great question, because that's one of the biggest difference between acupuncturists, or how do we find out which points?
Yeah.
The traditional acupuncture people are going to look at your tongue, they're going to take your pulse and come up with their points. Physicians tend to use a formula that we know that these points for the knee tend to work, so we use the same points and we don't do what's called the acupuncture diagnosis. Mm-hmm. Now the wire, and I call it a wire, not a needle, because it's a solid. There's no hole in it like a needle. Now there's 3 parts here. The first part I'm just going to take out. That's just a little spacer. But what you'll see here is a wire and a guide tube. Now the guide tube is just a tiny bit shorter than the wire. So what we'll do is we put the guide tube on your knee and then I just tap the top and you can see the wire's only going to go in a very small amount. So then we find the point, and as I said, that's different between various doctors, but the first point for the knee is typically right up here in the quadriceps, and sometimes the points are a little tender, so we'll poke around and just find a spot.
Okay.
Then we put the guide tube on there, and again, tap the guide tube.
Oh.
Did you even feel it?
No.
Barely at all, right? Now, once it goes in a little, we manipulate the needle by twisting it and putting it a little bit deeper, and that one's done. And then we would do 2 or 3 more here, one around your ankle. So the next thing we would do is we take what's called a TDP lamp. In China, they call these miracle lamps, and they're used a lot by the Olympic athletes. And they use a electromagnetic energy in the infrared spectrum, slightly different than infrared, and it's thought to also promote healing. And we would leave this on probably anywhere between 15 and 25 minutes. And that would be a treatment. And then when the treatment's done, we just remove the wire. That's simple. Well, now you came in and you said that you were terrified of needles and interested in acupuncture. Did that hurt?
Not as much as I thought it would. Actually, not at all.
Okay. All right. So hopefully you had a good experience.
I did.
So if anyone at home is interested in acupuncture, how can they get in contact with you?
Well, of course, they're always free to just call the clinic or visit our website at ferezyclinic.com.
Well, thank you so much for talking to us today,
Dr. Ferezy of the Ferezy Clinic.